Hey guys, thanks for joining me today. My name is Kim Narker and I'm the host of the Stretch Mobility Coach. And today I want to talk about hips and their health. And I'm going to kind of tell you a personal story and then weave it into what is going on so that you better understand what is going on with your hips, and then tell you how to keep your hips healthy so you can stay away from those total hip replacements and other surgeries like that. So what happened to my hip? Well, guys, I woke up this morning and I went to the gym and I noticed that when I did a lateral lunge exercise, my left hip, it just didn't work right. I'm just going to say that it felt really weird and awkward with that movement, and only to the left. To the right, it was doing really, really well, but to the left, something weird was going on. And I knew exactly what was going on. And so I'm going to break it down in this episode today. So 2 weeks ago, I was at the grocery and I turned like I normally do. I was pushing the cart. And for those of you that know me, we call it buggy in the South, but I live in Ohio, so it is a cart up here in Ohio. So I'm pushing this cart and I turned to the left and I felt this extreme pop in my left hip. And it was really deep. And honestly, for a split second, it actually took my breath away. And then it was completely gone, and I never felt anything else again. And I'm in my 50s, and things are not like they used to be, and my joints are tighter. I'm not as strong as I used to be, and it really concerns me. Now, I've been studying the deconditioning cycle in the body for about 10 years now, and I've seen the effects of this debilitating cycle in my clients and firsthand with myself. And I won't bore you with the details of this cycle at all, but I will tell you that this cycle is the cause for most of the pain and tightness that we all experience as we age. And when I was in school, we were educated very briefly on the deconditioning cycle, but in the last 10 plus years of research, I found this cycle to be more complex than I was trained to believe it to be. And I saw this cycle to be related to external factors. That means it was related to if I stumped my toe, or if I fell down, or if I injured something externally. But this cycle can actually be exacerbated from internal reasons. And most of us are not really educated on the fact that things like stress, emotions, feelings, and also internal factors can actually cause this deconditioning cycle to start. And mine started with that internal pop, okay? Now, it wasn't necessarily the hip that was the true reason behind it, but I won't get into that. But the effect of these internal dysfunctions that pop cause our brain, our nervous system, our joints, and our muscles to lock down. And it takes about 2 weeks after a pop like that, or something else, whatever it is internally, most of them won't be recognized, for us to see or feel a difference. So the hip pop that occurred and then it felt better actually caused a pathway in my brain via my nervous system to send a message to my left hip joint and all of the muscles that stabilized my hip joint, and it shut that down. That was why when I performed that lateral lunge at the gym, I felt really weird and different, even though I didn't do any exercises that were different than I typically did. Now, many of us feel something weird when pain is not present, and then we never, ever think about it again. And what I want to teach you here is that pain is an indicator of a problem, okay? It means that your muscles, your nervous system, your skeletal system is not working properly. And I actually educate my consumers and I teach my therapists that pain is actually a warning sign. We've not been taught how to improve the health and wellness of our neuromuscular system, nor have we been taught when to seek care to keep the neuromuscular system at its peak. Now, I started this YouTube channel, it's been about a year now, to help teach and educate my community on what the neuromuscular system needs to be healthy. And I'm on a mission to help you live your life without limits. And our current healthcare system teaches us that stretching, massage, strengthening, and medications are going to keep us healthy. And I'm here to dispel those myths completely and help you better understand your body so that you can avoid the path that can lead you directly to surgery. Now, the way to stay off that surgical path is to listen to your body's signals. Pain is a warning of danger, and tightness is a signal that your joints, your muscles, and your nervous system are working overtime to keep you healthy. Now, your body's way of keeping you moving is by turning communication via the nervous system to all of the joints and muscles off. Okay, and I know that sounds really weird, but it's just the way that our body functions. You see, your body wants to do everything that you want it to do. So if you want to jump, if you want to do hopscotch, if you want to squat, if you want to get down to the floor, your body, your brain wants you to be able to do that. However, after you do it, you're going to feel pain or you're going to feel tightness because your body was not prepared, nor was it in a healthy enough state to perform that action. So when this is happening, your body is actually turning things off, and it recruits help from other joints and muscles. And that pathway that was there is no longer there, and it's no longer working effectively. And once this pattern is started, it cannot be stopped until you seek care from a specialist that knows how to connect all of that stuff back together and do it in the right order. To date, the only specialist that understands this cycle is a stretch mobility coach. And stretch mobility coaches are specially trained in the deconditioning cycle. They're trained to find where your problem originated from and can build a program that will break the cycle that leads to deconditioned muscles and ultimately leads to degeneration. That degeneration and those changes lead to surgery. Now, typical surgeries that you have that start with this deconditioning cycle are hip replacements, knee replacements, ankle replacements, shoulder replacements, and spinal surgeries. And we found that these surgeries can be avoided. And the way they can be avoided is for me to get on this channel and teach you and everyone else out there that you need to listen to the signals your body is putting out so that you can seek care from the right individuals. Now, stretch mobility coaches are there to help you when you feel something weird. For me and my hip, my plan is to schedule a visit with my stretch mobility coach so that I can learn why my hip popped in the grocery 2 weeks ago. And I know for sure when I go into a consultation, my coach is going to perform some tests, and they're going to probably look at my low back. They're going to look at my pelvis. They're going to look at my hips and maybe look at more things to see what is not working the way that it's supposed to be working. You see, we have baseline measures that we follow as stretch mobility coaches, and that is not followed by any other profession. In fact, there is no book out there right now that shows us how to keep our musculoskeletal system healthy. We are writing that book as we speak. Now, once my coach goes in and looks at my back, my pelvis, my hips, and whatever is causing my problem, they're going to then work on me and perform some treatment on those joints to get them to where they are moving in a more healthy state. And then their goal is to turn back on that pathway from the brain, the nervous system, the joint, and the muscle, and then rebuild the system so that the muscles that have been affected can work correctly, the joints can stop being locked down, and normal function can occur. Now, I know that that's a lot of information, but I know that these stretch mobility coaches are going to recommend a successful program for me that will reestablish the pathway that has been turned off to my brain and rebuild all the joints and muscles that were affected from that hip pop. Just because that hip pop happened and pain did not continue doesn't mean that something did not happen. And I know from my experience and my training that my hip pop probably is coming from my low back, which is sending a message for my hip to be in a tightened state. Now, this stretch mobility coach is going to prescribe a program, and I will be seeing a stretch mobility coach for 2 times a week, probably for about 4 weeks. But this is how I keep my hips healthy for life. And if you are experiencing something weird in your hips and you're looking for real answers that will actually give you a way to improve your mobility, improve your strength, and help you to live your life without limits, then take a look at our Find a Coach page. Go to www.thestretchmobilitycoach.com and then /find a coach. And you're going to find a coach near you and schedule a healthy hip consultation today. You will be glad that you did it, and you will be able to stay away from surgery. I hope this information was helpful for you, and I appreciate you joining me today. Thanks so much.